Thanks for joining us on Chicago Tonight. I'm Brandis Friedman. Here's what we're looking at. The Trump administration is planning to exclude nursing as a professional degree. What that could mean as the country already faces a nursing shortage. And new CDC guidelines suggest a link between vaccines and autism, alarming health professionals. First off tonight, a coalition of advocates are speaking out today in support of the multi-million-dollar deal Northwestern University has struck with the Trump administration.
The resolution agreement between the federal government and Northwestern University marks accountability and the beginning of real change. Above all, it recognizes that Jewish students at Northwestern were not given the civil rights protections that they were entitled to.
The Coalition Against Anti-Semitism at Northwestern, or CON, along with others, say the $75 million federal penalty the university agreed to pay is, quote, staggering, and a reflection, they say, of how deeply the university failed to protect students and the community. The deal also requires the university revoke an agreement with pro-Palestinian protesters, which it signed last year in exchange for the end of tent encampments on campus. While some groups are praising the move that now releases millions in federal research dollars to the university, others are calling it extortion and say the university is bowing to government overreach. Illinois is responding to a new fee the Transportation Security Administration is charging folks traveling without a real ID or other compliant document. Yesterday, the TSA announced a $45 fee to use an alternative identity verification system at airport security for those who don't have the ID or a passport.
Put this in perspective, a one-way flight from Midway to Boston on Southwest alone can cost less than this new penalty. For a family of 4, that fee could total $180, and if their trip lasts more than 10 days, it could jump to $360 just to get through airport security.
In response, Secretary of State Alexei Janulius says his office is making it easier for folks to get the Real ID by extending the lease on the Real ID Supercenter through the end of next year for faster service. In addition to streamlining dedicated websites, he's also partnering with Cook County Clerk Monica Gordon to help folks get the correct documentation needed for the Real ID, like birth certificates and marriage licenses. A key city council panel is advancing a proposal to ban the sale of intoxicating hemp products in Chicago. The city's License and Consumer Protection Department committee advanced the measure 10-6, which now heads to the full city council to vote on next week. It faces an uncertain future, though, as Mayor Brandon Johnson opposes a citywide ban, and dozens of business owners have also pushed back on the plan. The city's Department of Business Affairs and Consumer Protection says the proposal would threaten 200 businesses and is instead pushing for an alternative measure that would ban the sale of those products to people under 21 years old. If you haven't had enough winter already, prepare for more. The National Weather Service says a blast of Arctic air will send temperatures plummeting into sub-zero territory over the next couple of days. Tomorrow will be the coldest, with lows in the negative single digits and wind chills -15 to -20 degrees. Friday starts off pretty cold too, then gradually warms up, but still not past freezing. Check out our website for cold weather tips and where to find warming centers. Up next, a potential new financial hurdle facing nurses. That's right after this.
Chicago Tonight is made possible in part by the Alexandra and John Nichols family, the Polk Brothers Foundation, and the support of these donors.
The Trump administration is planning to remove nursing degrees, among others, from the professional degrees category starting in July. The change would lower how much graduate nursing students can borrow for school. The move has sparked pushback from nurses nationwide who worry it could make degrees unaffordable and deepen an already severe nationwide nursing shortage. Joining us to discuss the move are Eileen Collins, Dean of the University of Illinois Chicago Nursing College, Lorna Finnegan, Dean of the Nursing School at Loyola University Chicago, and via Zoom, Roxanne Spurlark, Chief Nursing Administrator and Interim Director of the DePaul University School of Nursing. Nurses and deans and leaders of nursing schools, thanks to all of you for joining us. Eileen, what is the professional categorization of degrees, and what would it mean for nursing degrees to be out of that category?
So the Department of Education defines a professional degree as a profession that needs a graduate degree and generally needs a license. So in nursing, nurse practitioners need a graduate degree in order to be a nurse practitioner. Also, CRNAs, or nurses who do anesthesia, also need a graduate degree, and they also need to take a licensure exam after they're finished with their degree. If the amount that a nurse can borrow to go to school gets pushed to where they can't afford it, it really creates shortages throughout not only the city of Chicago, but the state of Illinois. So for example, many counties in the state of Illinois do not have any anesthesia providers whatsoever. So if nurses fill that gap, and they work with anesthesiologists in all kinds of different settings. So if we don't have those nurses becoming nurse practitioners and CRNAs, then it'll create a worse shortage than what we already have.
How could this impact students who are currently enrolled in graduate nursing programs and they're relying on these loans to pay for their education?
So it won't impact the nurses who are currently enrolled. It will impact those students who want to enroll after July 1st. So the students who are currently enrolled are grandfathered in, but the ones who want to start next year, for example, in the next academic year, they won't be able to access those loans. And a big concern is that they will take out loans, but they'll be from predatory lenders, and then they'll have these exorbitant interest rates, and they may have to drop out eventually.
Roxanne, during the pandemic, of course, we all know that nurses were described as heroes, and anyone who's ever needed some nurses in the hospital knows the work that they do. In your opinion, does this change signal a shift in how the government views the importance of the profession?
Thank you for inviting me to the conversation, and the short answer is yes. For 22 years, the Gallup poll has ranked nurses as the most trusted profession in this country. And on top of that, nursing is the largest workforce in healthcare. So when we think about these shifts, we have to think about it from the stance of where it happens now in acute care. If we're looking at a shortage that is already in process, and we are looking at nurses that are at retirement age and leaving during the pandemic because of other stressors, we have to acknowledge that if there's a breakdown in the availability of nurses, which we already know is being impacted, those nursing students that would be produced would still stand at a halt because we would not be able to produce those to enter. In 2023, it was noted that there were 1,977 vacancies for individuals that were prepared to teach at the graduate level. So if that were the case, then that means that we had to turn away somewhere around 60,000 nursing students that were qualified and eligible to enter that space. So when we think about this, acute care is definitely going to be impacted because of the quality and standards that we have to meet to be able to provide quality and safe care.
Lorna, the change we know won't affect undergraduate nursing students, but it will make it harder for students to pay for graduate programs, as we've discussed. Describe what some of those graduate programs are, please, and the jobs that those students can typically take on after graduation.
So typically they can become an advanced practice nurse, and there are 4 categories of advanced practice nurses. Nurse practitioners diagnose, prescribe, and treat illnesses, and certified registered nurse anesthetists deliver anesthesia. Clinical nurse specialists oversee really complex care, and nurse midwives deliver babies. So besides advanced practice, it also affects the future pipeline of nursing faculty, because nursing faculty are all graduate prepared, preferably with a doctoral degree, and also nursing researchers. So So it really has a wide impact.
Is this a slippery slope? Right now it is about the money that a nursing student, an undergraduate nursing student can borrow, but could this lead to other ways that the profession is further diminished?
Well, yes. I mean, especially when you think about reducing the pipeline of nursing faculty, that will then reduce the pipeline of students who are entering the nursing profession because there won't be enough faculty to teach them. So ultimately, it will worsen a very bad nursing shortage as it is. And it's really about public health. It's going to have a negative impact on public health. Nothing gets better with fewer nurses, nothing.
Eileen, the Undersecretary of Education, Nicholas Kent, has argued that these changes are intended to pressure the schools, the universities, to lower tuition costs for students so that they don't have to take out such large loans. Do you think that'll be the case? Will nursing schools respond with just lowering the costs?
We can't afford to do that as a nursing school. If you think about it, the healthcare environment is increasingly complex. Therefore, the complexity of teaching students goes up. We require complex simulation laboratories. We require faculty who are at the top of their game. And you can't hire faculty at the top of their game at a very low price. So we don't want to water down and dilute the quality of healthcare that our students can provide. Right now, the United States has one of the best healthcare systems in the world. And we are there because students, whether they be nursing students or physicians or dentists, are educated by people who are at the top of their fields. We want to continue that so that the United States, Chicago, the state of Illinois, continues to provide excellent health care.
Roxanne, I know that you've emphasized diversity and equity and inclusion. Excuse me, that's not right. Lorna, this question is actually to you. You've emphasized diversity, equity, and inclusion at the Loyola Nursing School. What impact could this change have on the diversity of enrollment?
Huge. What it will do is it will create a two-tiered system because underrepresented and minority students are more likely to take out loans. They generally come from less generational wealth, and they have less access to private loans. So therefore, there will be less underrepresented and minority students entering advanced practice, less faculty. It will ultimately then affect care and access to care and health equity, because underrepresented students are also more likely to work in underserved communities and deliver culturally concordant care where they are delivering care to patients just like them. And then ultimately it will then reduce access, especially in rural areas and in behavioral health areas. And it will reduce the number of underrepresented faculty. We've worked really hard to increase nursing workforce diversity, and it's just going to take us on a slope back down again. So it's really going to have a great impact.
Roxanne, we've also seen federal funding cuts to hospitals that could affect tuition reimbursement for nursing students. You have a Doctor of Nursing practice degree, and that's one of the programs that may become harder for students to afford. How important is it to have multiple avenues of financial assistance when pursuing a degree like that in about 45 seconds?
Well, the short answer is that it cannot be done. When we think about individuals who hold the same type of credentials that I have, it represents about 1% of the nation. And in doing that, we have to want a healthier and more just future. And if you want to provide for this, we are the ones who were being put in front to address many of these shortages. And if we are not there to look at the areas where we're having the shortages of physicians, which is true and in-game fact, if we cannot address these, then the profession that has carried this country through every crisis will have an issue.
We'll have to leave it there. Best of luck to all of you. Thank you for joining us. Eileen Collins, Lorna Finnegan, and Roxanne Spurlock. Thanks, everyone.
Thank you for having me.
Up next, the possibility of major changes to childhood vaccination guidance. Long-standing guidance on vaccines for children could soon be upended. An advisory committee overseen by Health and Human Services Secretary Robert F. Kennedy Jr.'s Vaccine Advisory Board will meet tomorrow to discuss the medical guidance of a hepatitis B vaccine, which is currently given at birth. This follows the Centers for Disease Control and Prevention changing its stance on the unproven link between vaccines and autism. The updated language on its website reads, quote, "The statement, quote, 'vaccines do not cause autism' is not an evidence-based claim. Scientific studies have not ruled out the possibility that infant vaccines contribute to the development of autism. However, this statement has historically been disseminated by the CDC and other federal health agencies within HHS to prevent vaccine hesitancy." Joining us to dive more in depth on this are Dr. Michelle Barnes, president of the Illinois chapter of the American Academy of Pediatrics and professor of clinical pediatrics at UIC and UI Health; Dr. Max Brito, professor of infectious diseases at UIC and vice president of the Infectious Diseases Society of America; and Dr. Robert Murphy, executive director of the Harvey Institute for Global Health and John Fair professor of infectious diseases at Northwestern University. Welcome back, all of you. Thanks for joining us. I think it's also important to note that on that same front page of the vaccine website for CDC, there's the sentence that reads, "Vaccines do not cause autism, asterisk." And then you go further down, they don't cause autism, and you go further down and it explains that they did not remove that sentence due to the agreement that the chair of the Senate Health, Education, Labor, and Pensions Committee made to keep that on the website. Dr. Brito, was this new claim from CDC that vaccines can cause autism, was this alarming for you?
It is alarming. Vaccines do not cause autism, so the initial statement is right. I mean, all of these links between autism and vaccines comes from a fraudulent study that was where the falsified data, the author of this study falsified the data. And since then, there have been 16 epidemiological large-scale studies that have proven or have failed to prove that there is a link between autism and vaccines. Very well-designed studies, more than almost 2 million kids have been, data on 2 million kids have been examined, and there is no link, there's no proof that vaccines cause autism.
Dr. Murphy, given all of that, right, there is no proof. Is it hard to prove a negative, and is that what this administration is relying on?
Well, it's hard to say 100% absolute sure that no vaccine ever caused autism or caused autism. You know, you can say that, but we're talking like chances like 1 in a million or 1 in 10 million chance. It's almost zero. One of those studies that Dr. Brito mentioned was 550,000 children. About 80% had the vaccines and 20% didn't. And they looked at them and there was absolutely no difference between the development of autism. It's the biggest study to date, the epidemiology. It's a study from Denmark. So, you know, study after study after study, and that's why Senator Cassidy made them keep that in there, or he wasn't going to prove Secretary Kennedy to be Secretary of Health and Human Services.
Yet he did, and
right. So they have to keep it there because of that.
With an asterisk, which basically then the rest of the page kind of, what's the word that I'm looking for? It defeats its own purpose.
That statement.
Yes. Dr. Barnes, what are you hearing from parents and caregivers? Is there growing vaccine hesitancy?
There is growing vaccine hesitancy, and we've seen that over the last several years, but I would say increasingly in the last year. But we see it as an opportunity for us as pediatricians to be the trusted healthcare provider that we are for children. Vaccines save lives. They help children to stay in school and to be healthy, and that's what we want for our patients, just as we know that that's what parents want for their kids. And so what we try to do when parents express hesitation about vaccines is really just to try to talk with them about what are their concerns, try to address their concerns, and then really work with them to make sure that they make healthy and safe choices for their kids to remain healthy.
Dr. Brito, so if the Hep B vaccine, if it ends up getting pushed back on the schedule, which it's currently within 24 hours of delivery, what could be the immediate and then the long-term impacts of that?
Yeah, the long-term impact is many more cases of chronic hepatitis B in kids, in infants, which is a fully preventable disease. And what that does to kids is increase their risk of developing cirrhosis, which is scarring of the liver, or liver cancer later in life. And why would you want that for your kid if you can prevent it with a shot at birth? There is absolutely no evidence that that causes any harm, and it prevents a lot of morbidity. We were talking earlier, it would prevent, I mean, continuing the program would prevent more than 100,000 cases of this disease.
Dr. Barnes, if the recommendation does change and if they suggest delaying it and giving that vaccine later on, what could the impact be on insurance coverage?
Well, the impact on insurance coverage, we don't know. So across the federal government, I think that remains to be seen based on the relationship between ACIP and the federal insurance companies or federal insurance organizations such as Medicaid. However, in Illinois, Governor Pritzker has really tried to ensure that our patients and our children, our families will be able to continue to get the vaccine regardless of what the changes are to the federal guidelines, with the understanding that the new Illinois Advisory Committee on Immunizations can make recommendations for Illinoisans and will ensure that they have access to the vaccine regardless of the type of insurance that they have.
Okay, and we're going to come back to that in a bit as well. Dr. Murphy, so the Trump administration, they are studying the safety of aluminum in vaccines. Why is there aluminum in some vaccines?
So aluminum is the most common metal on Earth. It actually is 9% of all the metal on the entire Earth, the whole planet Earth. It's everywhere. It's in the water. It's in all your food. It's in vegetables and fruits and everything. It's in the environment. It's basically a ubiquitous substance. They put it into the vaccine because it acts as an adjuvant. It actually makes the vaccine work 10, 100, or 1,000 times better than without it. So you can give less of the vaccine if you have just a little bit of aluminum. We're talking about 1 milligram to 1 in 1,000th of a gram, or even less than that in a vaccine. There is more aluminum in baby formula, in 2 doses of baby formula, than in a vaccine. So if you're worried about aluminum causing autism, you basically almost can't give any of the foods out there, including formula, that over 60% of kids take. So where are we going to stop? The reason why they're saying aluminum causes it, because aluminum is everywhere. We're exposed to aluminum all the time. It doesn't do, it's at that amount, it does nothing.
It's kind of like with Tylenol, right? It's everywhere, right?
It's
How
everywhere.
can you say that's the thing?
Exactly.
Why is aluminum a concern? I mean, we've taken aluminum out of deodorants, for example. Why is it bad to have aluminum?
Well, it's still in a lot of deodorants, and it's still in toothpaste, and it's still in your food. It's still in the food chain. You can't take aluminum basically out of the environment. There's so much of it.
Governor J.B. Pritzker, he signed a bill yesterday to safeguard against federal anti-vaccine guidelines. Here's what he had to say.
While RFK Jr. and his QAnon-inspired colleagues spreading conspiracy theories and dangerous misinformation about vaccines are running around Washington, Illinois is stepping up to protect the health of our people. And while some other states are denying proven science to serve the MAGA Republican political agenda, Illinois is listening to the experts and making life-saving care more accessible.
Dr. Barnes, how can states respond to this, and is Illinois doing the right things?
In my opinion, yes, Illinois is definitely doing the right thing. I think we're so fortunate to have a governor that's really looking out for the interests and needs and the health, really, of the children and families in Illinois by allowing us to make the decisions that allow us to have the best health care possible for our families here.
Is it enough to prevent potential outbreaks?
Vaccines save lives. And vaccines prevent illness, and vaccines prevent people from missing school, missing work, and allow them to do all the things that they should be doing, kids in particular. And so by encouraging and enforcing that we will have access to all of the recommended vaccines here in Illinois, Governor Pritzker is doing all he can to make sure that we have that available to us.
Dr. Brito, a few seconds left. If the CDC's guidance may not be the most reliable anymore, where can folks turn to get the best information?
Well, they can turn to medical societies, for example. Some of the medical societies are coming up with their own guidelines on their own recommendations. There's the Vaccine Integrity Project that is parallel to government efforts that is trying to put out sound scientific evidence to get parents to make the right decisions. And parents should definitely vaccinate their kids.
Okay, we'll have to leave it there. Thanks to all of you for joining us again, Dr. Michelle Barnes, Dr. Max Brito, and Dr. Robert Murphy. Thanks, everyone.
Thank you.
And that is our show for this Wednesday night. Join us tomorrow night at 5:30 and 10. The 9-3 Bears lead the NFC. Is a playoff run in sight? We break down their chances with James Big Cat Williams. No touchdown dances. Now, for all of us here at Chicago Tonight, I'm Brandis Friedman. Thank you for watching. Stay healthy and safe, and have a good night.
Closed captioning is made possible by Robert A. Clifford and Clifford Law Offices, wishing all a happy and healthy holiday season.